Monte Carlo simulations are widely used in healthcare and epidemiology to model disease spread, evaluate medical risks, and optimize treatment strategies. By running thousands of probabilistic simulations, researchers and policymakers can make data-driven decisions to improve public health. Why use Monte Carlo for healthcare and epidemiology? Medical and epidemiological data often involve uncertainty. Monte Carlo methods help by simulating the spread of infectious diseases under different scenarios, evaluating treatment effectiveness and patient outcomes, optimizing hospital resource allocation to manage patient loads. Case study: pandemic spread simulation. During a disease outbreak, Monte Carlo simulations can 1. Model how a virus spreads based on transmission rates and social interactions. 2. Simulate the effects of interventions like vaccinations or social distancing. 3. Provide probabilistic forecasts to help governments plan healthcare responses. Risk assessment in medical decision-making. Monte Carlo methods support medical professionals in predicting the probability of disease progression in patients, assessing the risks and benefits of new treatment options, estimating the impact of medical errors on patient safety, optimizing healthcare operations. Hospitals and healthcare providers use Monte Carlo simulations to forecast patient demand and optimize staff scheduling, improve the efficiency of emergency response systems, reduce costs while maintaining high-quality patient care. Challenges in healthcare: Monte Carlo applications. Data quality requires reliable epidemiological and medical data. Complex interactions. Modeling human behavior adds unpredictability. Computational cost. Large-scale simulations can be resource-intensive. Conclusion: Monte Carlo simulations provide healthcare professionals and policymakers with powerful tools to model disease dynamics, evaluate medical risks, and optimize healthcare systems. By leveraging probabilistic forecasting, we can make better decisions to protect public health and improve patient outcomes.